Thank you very much, Mr. Chair. Thank you to Ms. Bosler, to Mr. Pettek, to the Assembly budget staff, to the finance staff and LAO staff. This is not a normal budget, so thank you for all of your hard work and your tireless dedication to the state of California. Really, really appreciate it. I also appreciate the opportunity to have a 4-minute period to ask questions, though I know that these questions cannot be given the respect that they deserve with that time frame, and so I do anticipate answers at a different point in time or written that can give us the information that we do need and the analysis that I think also is required during this time. Earlier this year, I introduced AB 2646, which would have eliminated ADA funding and replaced that with a student enrollment-based funding. This was adopted in SB 117 this year, but it is not adopted in the revise as it is presented, as I understand it. Given the uncertainty about attendance next year, heightened awareness that maybe if a child is sick, that child should not be coming to school, parents' work schedule or sibling school schedules, it will be hard for people to maintain the attendance that they would want their children to have. And then, of course, we also know that we've lost some kids and we need to find them again. None of this should penalize a classroom, the funding that the classroom needs. And so I would like to recommend that the administration and legislative leaders move to an enrollment-based funding mechanism, not just next year, but really for time in perpetuity in the future. I also want to continue the concerns we've heard from my colleague from Escondido and others about the safety of prisoners in our prisons. We need to have agreed upon written plans with the prison facilities and our county public health officers about what to do if there is a surge of infection. We know that our local hospitals cannot deal with both an influx of patients from our prisons if there is also a simultaneous surge in our communities. San Quentin, for example, by where I live, would go to the hospital where my children were born, which has 14 ICU beds. That's hardly enough to deal with the local population, let alone what an outbreak could do at a prison of 5,000 people. We know in California's prisons over 900 have been infected with COVID, over 50 have been placed in community hospitals across the state, and we want to make sure that they're not overwhelmed and they can deal with those surges. We also heard concern from my colleague from Sacramento about education funding, particularly higher education. As people are underemployed or unemployed, they may need to shift, I hope that they want to spend time training or going back to school, and that could have increased demand on our community colleges and our institutions of higher education or other skill-building centers for learning, and we need to be making targeted investments to anticipate that need as well to provide the rebound that our economies will so desperately need.
30 seconds.
I also heard from my local communities about the holdup of federal funds. And they need, if they're smaller communities, they need to get those federal funds. Should we be writing, this might be for the LAO, writing into there a formula to get those funds to those local jurisdictions? And lastly, when we're cutting so many important programs, are we making our investments wisely? So with our OPEB payments, are we subsidizing in areas for retirees that we already have state and federal subsidies for? And we may need to have some very deep analysis to make sure that we are stretching every dollar as far as it will go. Thank you so much.